Thank you to Steering and Policy Committee for their hard work in organizing these hearings so our constituents can be heard despite Speaker Johnson continuing the congressional Republican vacation for more than a month. And thank you to our witnesses for being here today. As we discuss the urgent need to prevent the devastating cuts to health care and the impacts of the Republican shutdown, I'm honored to introduce my constituent today, Miss Lindsay Latham. Lindsay and her husband, Toby, live in Fairfax County, Virginia, where they're raising their 10-year-old son, Calvin, and their daughter, Lucy. As Lindsay will share, Calvin has multiple disabilities. And like so many families navigating disabilities and complex medical challenges, Lindsay and her family rely on Medicaid coverage and support from the Department of Education's Office of Special Education Programs, both of which Trump and Republicans are trying to slash. During his campaign for the presidency, Donald Trump looked into the camera and promised he would not cut Medicaid. Then, he proudly signed into law the largest cut to Medicaid in history. He lied to Lindsay and her family. He lied to millions of Americans who rely on Medicaid. And earlier this morning, Lindsay described to me how she felt when she heard congressional Republicans cheering after they passed the big ugly bill. She told me that she sat in her car in her driveway and she sobbed. Adding insult to injury, Donald Trump and Russ Vought are using the shutdown to, in their words, punish Democrats. On October 10th, the Trump administration and Russ Vought announced the illegal firing of 4,000 federal workers. On October 11th, we had a fall festival in Fairfax. And I spent several hours there talking to hundreds of my constituents. I heard stories of how the health care cuts would impact them. I heard from federal workers who had been fired, attacked, denigrated over the 9 months of Trump's term. But there's one conversation that has stuck with me. A gentleman came up to me and he told me that he received the RIF notice the evening before. This was Saturday morning. He received the RIF notice Friday evening. And he worked at the Department of Education in transition services to help kids like Calvin and families like Lindsay's navigate the challenging transition from secondary education to support in the community or workplace supports. And like Lindsay, he was sobbing. He was sobbing not because he lost his job. He was sobbing because he knew that kids like Calvin and families like Lindsay's would no longer have the services that he and his colleagues delivered to them in the Department of Education. So if Donald Trump and Russ Vought think they are punishing Democrats in Congress, the reality is they're punishing families like Lindsay's and kids like Calvin all across this country. So I want to thank Lindsay for her courage in speaking today, for her advocacy on behalf of Calvin and millions of kids like Calvin all across this country.
Good morning, members of the committee. My name is Lindsay Latham, and I'm from Virginia. I'm grateful for the opportunity to share my family's story with you today. Our son, Calvin, was diagnosed with multiple disabilities at 15 months old. Thanks to the Department of Education and Medicaid, he began receiving early intervention services. At 2.5, he transitioned to a half-day preschool program for students with disabilities, where, thanks to Medicaid funding, he received in-school services such as occupational, physical, and speech therapies. Medicaid also provided the evaluation that led him to be issued an augmentative and alternative, or AAC, communication device. This device opened up a world of possibilities for him. These services are currently benefiting nearly 1 million children. In those early years, we were naive. His school team cared deeply, but their resources were limited, and Calvin's language development began to lag behind his typically developing peers. The tools and training needed to implement AAC meaningfully in the classroom were and still are being developed in our school systems. Grants from the Office of Special Education Programs, OSIP, provide funding to bring special education professionals and paraprofessionals evidence-based practices to the classrooms. As we struggled to navigate these challenges, we became active in our community and helped start a county-wide special education PTA. Through this work, we heard countless stories, some heartbreaking, about young students being restrained and secluded as early as the age of 5. As you can imagine, causing significant trauma. These concerns led to a lawsuit which ultimately banned seclusion in all but 2 schools in our district by 2022. Recently, the Commonwealth of Virginia's Joint Legislative Audit and Review Commission, JLARC, released a report on special education that underscores why federal oversight by OSERS is so critical. The findings were alarming, to say the least. Over the last decade, Virginia has decreased the spending on students with disabilities by 16%, even as the population continues to grow. Half of the IEPs lacked measurable academic or functional goals, and students of color with disabilities are disproportionately impacted by these failures, just to name a few. It is OSIP that collects, analyzes, and reports this data to ensure proper funding, appropriate staffing levels, resources, and trainings reach the classrooms. They uphold the IDEA's promise that every child, regardless of their ability, deserves a free and appropriate public education. Right now, OSIP should be collecting the data and analyzing it to evaluate the use of the $15.1 billion in grants distributed to states in fiscal year 25. They should be using this data to determine where these resources will be allocated for fiscal year 26. But these critical activities are not happening due to the government shutdown. Now we have learned that on October 10th, the administration informed approximately 95% of OSIP staff that their jobs will be eliminated within 60 days through the reduction in force. Additional key offices within the department that are critically important for students with disabilities have been gutted, including the RSA, OCR, and OESE. Unless reversed, these rifts will become permanent by December 9th, 2025. Legally, states will still be required to provide services spelled out in my son's IEP, but without federal oversight, how will we be able to enforce these services in schools if the school decides to stop providing them? Without federal oversight, what recourse do families have if their child's rights to a free and appropriate public education are not fulfilled? The answer to this, of course, is none. Families of students with disabilities are terrified about the prospect of permanently losing the Department of Education and its oversight of special education and rehabilitative services. This, coupled with a budget law that cuts an historic $1 trillion to the Medicaid program, is just too much for our families to bear. Please do everything you can to stop dismantling our civil rights. Thank you for your time and your commitment to protecting the rights of students with disabilities.
Thank you, Lindsay.